UVM Medical Center is once again defending its policies and practices as the Department of Justice gets involved in a religious discrimination complaint dating back to May of 2018. The DOJ filed a suit on behalf of the Department of Health and Human Services, which accuses UVM Medical Center of forcing a nurse to assist in an abortion procedure despite moral objections. If you've heard this story before, we covered it a year ago, and now the update. So Local 44's Devin Bates joining us live in the newsroom to fill us in on what's happened. Devin?
Yeah, correct, Lauren. Well over a year since the hospital last heard from federal officials about this complaint, and UVMMC President Dr. Stephen Leffler said because of that, it came as a surprise. And last year, HHS had agreed to not recommend any further enforcement stemming from that complaint. Now, the hospital has also denied the allegations since they were first brought to light.
For the past year and a half, we've had no employee complaints. We've heard nothing else from OCR. We believe the issue was finished and completed. And then on Monday, I got a registered letter from them warning us that if we didn't sign an agreement that was different than what we agreed to a year and a half ago, they were going to take action against us by the end of day Monday.
The alleged incident happened back in May 2017. UVMMC conducted an internal investigation, concluded the facts didn't support the nurse's complaint, and updated its policies despite insisting they were already up to par. Now in December 2020, the DOJ disagrees. One official addressed the lawsuit during a pro-life accomplishments celebration at the White House on Wednesday.
The University of Vermont Medical Center had forced a Catholic nurse to participate in an elective abortion, even though the doctor performing the abortion knew that the nurse had placed her name on the hospital's list of conscientious objectors. Our suit alleges that the hospital has adopted discriminatory policies that authorize it to schedule conscientious objectors to assist with abortions.
In contrast, Vermont Attorney General T.J. Donovan released a statement calling UVMMC's conflict of care policy a reasonable balance between honoring the religious objections of its employees and its obligation to provide essential health care to patients.
This doesn't make a lot of sense on a lot of different levels. You have 35 days left in this administration. There's going to be a new attorney general. There's going to be a new president with different priorities. And I think we can say with certainty that no legal case or lawsuit gets resolved in 35 days.
Likewise, Planned Parenthood Vermont called the lawsuit nothing more than a political game by a lame duck administration. President and CEO Megan Gallagher also called it an attempt to infringe on the right to an abortion.
Government interference should never determine patient care. Barriers to safe, legal abortion infringe on people's rights and dignity, and they go against every commitment we as healthcare providers make to protect access to care.
UVM Medical Center is also pointing out that the lawsuit defies recent decisions issued by federal courts across the country. Live in the newsroom tonight, Devin Bates, Local 44 News.